Dr. Adalja, it's simple. America is bundled in with Kosovo, Lebanon, and Montenegro. It is about the idea of travel. When you look at our hospitalizations and the regional disparity of how we're dealing with this epidemic, are you surprised that Europe tells us we can't travel there?
I'm not surprised because we know that political leaders often run for travel bans and travel restrictions as their first way to reassure their domestic populations. But we know that travel bans and travel restrictions don't work. It didn't keep COVID-19 out of the United States, and it won't keep any of these cases out of other countries. Because, and I think now in the era when we have vaccines, when we can verify people's vaccination status, and we have testing, you can have much more freer travel, even when there are cases that might be higher in one country versus another. You can restrict travel to vaccinated people. You can ask for testing or serial testing. So I don't think we need to be in the era of travel bans. And remember, the U.S. still has travel bans on many parts of the world as well, which I don't think are keeping our cases down or our cases controlled, because we have a domestic problem and many other countries have a domestic problem. So I think we need to use the tools at hand to facilitate travel.
There's the travel right there, folks. On radio, I'm putting up my cell phone with my Excelsior pass on it. And Amesh, I mean, there it is. It's being solved at the state level, at the local level as well. Critically here, do you have a sense of optimism about where we're going to be on travel and business 3 months out, 6 months out?
I'm optimistic in the sense that people are learning how to risk calculate better. Vaccinations are going up. There are people that are getting infected, and that's going to give them natural immunity. So that's going to give you a little bit of a buffer. We're getting more and more people comfortable with using home tests to know their status if they have to travel somewhere or if they visit somebody and maybe they're not vaccinated and they want to know their status. But we're also, I think, coming to grips with the fact that COVID-19 is not going to magically go back into bats, that we're going to be dealing with it years from now. And our goal is to tame it, to remove its ability to cause crisis in hospitals. And I think that's something that's taken a while for people to think about. And once they actually realize that, I think they will start to go back to their lives. And at the same time, I think emphasize that vaccinations are the way to learn to live with this. So I do feel optimistic that we will start getting back to our lives. And indeed, in some parts of the country, in the United States, we are back to our lives because we vaccinated so many high-risk individuals that even though we see hospitalizations and cases, we're not worried about it in the way that we were early on. But we've got a regional problem in the United States, and I think that's the priority.
Dr. Adalja, how important are boosters to getting back to some sort of normalcy? And I say this as we look at Israel, that just recorded its highest number ever of cases, of new COVID cases, despite the fact that that nation is one of the most highly vaccinated.
You have to remember, this is an endemic respiratory virus. It's not going to go anywhere. And I don't think that third doses for healthy people are going to change the trajectory of the pandemic. It's first and second doses that will remove the ability of the virus to cause serious disease and hospitalization. And that has to be our goal, because if our goal is chasing mild illnesses in fully vaccinated individuals by continually boosting them or boosting them even once more, that there's really no off-ramp here. I think we've got to realize that this doesn't magically go back into bats, that we've got to try to manage this like other respiratory viruses that we deal with year in and year out, or we're never going to be able to move forward. I think that's something we have to really think about.
Dr. Adalja, do the health officials, do the senior health officials in the United States agree with you, agree with that assessment of how to look at the risk of COVID and how to live with it going forward?
I do think many of them realize that this is a virus that's not going anywhere. I think that what we've had is kind of a policy jumble where people have differing goals, because when you saw the CDC guidance for masks for vaccinated individuals, changing some of the requirements for vaccinated individuals recently, that sort of reflects this idea that somehow these mild illnesses are what we have to chase. And I don't think that's right. But I think from the very beginning, they've always talked about flattening the curve to be able to maintain hospital capacity. And I think that has to be the overarching goal when you're dealing with a virus like this. So I do think we're kind of there are some differences in policy ideas, But overall, I think people don't disagree on the biology or the epidemiology. It's just we have to take a step back as a country and say, where do we want to go with this? What are we going to do with the virus that's never going to disappear? And what's the best step forward? And I think that has to be reframing the entire debate now that we have vaccines. And I think we have to get first and second doses into people. That has to be the priority. And third doses, I think maybe down the line, but at the 6-month, at the 8-month interval, I don't think that's going to make a major difference. And again, we haven't seen the strong clinical data to show that this is something that's necessary, because we haven't seen the vaccines really erode where it matters, preventing serious illness and hospitalization.
How should we be thinking about the vaccines? And I'm thinking about the flu. Every year you test a few, you hope that you catch the right strain for that season. Is that how we should be thinking about the future of this vaccine?
Not necessarily. Remember, flu is a very different virus from a very different family of viruses. It has a lot of genetic characteristics that are different than the coronavirus. So what we're seeing, even with these variants that we worry about, like the Delta variant or the Beta variant, is that when it comes to vaccines, our original version of the vaccine, the one directed against the ancestral strain that came from Wuhan, that is able to handle the Delta variant, especially when it comes to what matters. So I don't think we're going to be in a prospect where we have to update the vaccine because the virus's strain has changed so much. It seems that even though it does mutate, the vaccines are able to do what matters. And I think that makes it so much easier than dealing with flu in terms of vaccines.